Honorable Kagiri asked about mean testing, flat rate. There's nothing called flat rate. We must assess. The bottom is 300. There are those who cannot even pay 50 shillings. So we must pay for them. So we don't want those who can pay 800 or 1,000. And that's why we have put this system as, you can pay a month, you can pay 2 months, you can pay 3 months. Those who can pay must pay. Those who cannot pay, then the rest of us is a pooling system. That's why the speaker is paying 47 plus. That's why members of parliament, I'm sure they're paying 32,000. That's why Mama Mboga will pay 300. Even within the Mama Mboga spectrum, there are those who have a kiosk. There are those who are carrying their merchandise on a mkokoteni. So there are different levels, but pooling the resource together will give our people a universal health care. But above all, the 21 million Kenyans who have registered, at a go, they can access any primary, public, private, face-based health facility, free of charge, budget allocated, appropriated by this House, Mr. Speaker. Mr. Speaker, there was an issue of, by Honorable Pauline on registration, Samburu being bottom. There are a number of ways you can register. If you have your iPhone, or if you have a phone which is Android, please go to www.sha.go.ke.
Mr. Asamburu herdsman.
I'm coming to it. I'm coming to it.
Yes.
I'm sure I'm giving the 4. If you wait. Those who don't have phones, like the herdsman, like the ones who look after my own cameras, Mr. Speaker. In every village, we have 107,000 community health workers. In every village in Kenya. You go to them, they will register you. Those who have kabambe or mulikamuizi, they just need to do *147#, you are registered. Those who have computers, those who have iPhones, we are upgrading an app on iPhone in the next 1 week. So there are many ways you can register. You can walk to the nearest Huduma Center. You can walk to the nearest SHA. So Honorable Pauline, I think, and then we'll make sure our counties, I agree with you, our counties, and when you go to Samburu and many others, you are sitting next to my member of parliament. This weekend, that's why I'm here, Mr. Speaker. This weekend, I want the members of parliament to be also helping us register. Yesterday, I asked the Council of Governors, let us publish the 10 counties, the best counties. And I want to thank the leadership of Mombasa County, and Nyeri, and Bomet, and Kirinyaga, and Elgeyo Marakwet, and Kericho, and Nandi. Mombasa, and my sister, the woman Rebizia, the governor and the leadership took deliberate. Today, 59% of the people of Mombasa have registered SHA. Bomet, Kilifi as a county, I've agreed with the governor, so they only allowed me to say the top 10. But from next month, every month we will do 10 counties. We are starting with Kisumu and Migori. And then we do every of the former 8 regions, we do 2. We will do Kilifi. We will invite the first day all the leadership, Mr. Speaker, from the governor all the way to the MC and our members of parliament. I will be there. So that we tell our people to register en masse. Already they are registering between 40 and 50,000. But some counties are lagging behind. I'll give an example of number 2, which is Bomet. Out of our target population of 875,000, 426,000 people in Bomet County have registered for SHA. So SHA is working. And it's helping the people of Kenya. Don't listen to the naysayers. Honorable Bissau, you talked about Trans Nzoia. You talk about county governments. Today, I want to report, before, during the NHIF defund, the private hospitals and the faith-based used to lead in terms of numbers. But today, 51% of Kenyans are accessing public facilities, more so level 2 to level 4 in our counties. The reason why? The drugs are there, the doctors are there, the facility is paid. We are not paying the county treasury. The facility is the one that is paid by SHA. And they claim it from SHA. So I think maybe that county is one of the counties that we shall visit. Minus politics. Minus politics. The lives of our people. Every leader, beginning with the president, the lives of our people is our constitutional and moral duty. Let us, at least for some time, I really want to help you. Even me, I think for the next 6 months, I will only talk about health and health and health. There are many, many other issues of health. But today I decided, let us deal with this. I didn't get the member for at the far end on the manipulation of the NHIF and staff audit. Yes, I said we have over 800 NHIF staff. In your own act, the SHA Act, you stated it that the first priority is given to the NHIF staff in a competitive recruitment to make sure their papers are in order.
Yes, Ferdinand, what's out of order?
Maybe it's just an input, but I said like Waziri,
Under what standing order are you making an input?
No, all I wanted to find out is a program, specific program. I think you talked about him going around, but I want him to come out very clear. What programs, apart from what you are saying using health workers, what specific programs are you putting in place to be able to educate the people on the ground to be able to register themselves with the SHA? Because it's important, and you are doing very well. But what specific program do we have? That's what I want you to tell me, not you going around.
Mr. Speaker, this is the first program I'm doing. I am talking to the leadership of this country. This is a very serious program. It has never been done. I am talking to 349 members. Even those who are not here, they will read the answer. There are many Kenyans who are watching me on TV. That is a program. As I told you, we will do a rollout for 13 counties. 13 counties. Western Province, we will do Kakamega and Bungoma. We have already done Elgeyo Marakwet and Nandi. We are going to do Kilifi. We are going to do Garissa and Wajir. We have done Embu for Eastern Province. Those are programs, Honorable Member for Kwanza and my old friends. So by talking to you, you'll help me talk to the people this weekend. And thank you, Mr. Speaker, for giving me this opportunity, because I think this is the best program. Honorable Speaker, my good friend, the Honorable Member...
Hold on, what is the problem?
Speaker, I just want to ask the Cabinet Secretary. Actually, the main saboteurs of this program are the staff of NHIF. Many times when you go to the offices, they say they have no idea at all what this SHA, chief or chief, whatever they call it. What measures is the Cabinet Secretary and the entire system put into place to educate and learn and encourage the NHIF staff to take over this program as if it's their own? Thank you, Honorable Speaker.
Speaker, if you could have allowed me first, I finish the questions. But we have a program for NHIF. This House passed a law that they should be given the first opportunity. We have five directors. Already we have appointed 4 who are from within NHIF in a very competitive recruitment. But don't use the word saboteurs. Saboteurs is a big statement.
Yes.
Why are they fighting the system? Because they were used to fraud. I'm not saying all NHIF staff. There was a fraud from the facilities to inside trading within NHIF. And that's why we felt technology will solve all these problems. We must secure the health of our people by making sure the facility is right. And I'm coming to the issue how we are going to deal with the Kemsa. Somebody has asked on the refill. Our health workers will not be in the streets, and they go and serve the people. So, Mr. Speaker, Honorable Wino asked that question on human resource. I want to assure you that a stable, firm, solid healthcare workforce is the success of SHA and is the success of universal healthcare. And we are committed to that as a government. USAID, I have many other questions. I've asked the Speaker, what happens to the many programs and staff who are under the USAID with the coming of the new administration in that? I'm going to answer. But in the next 5 years, this administration has put in place, and I'm sure the budget office knows, that we will recruit 20,000 new healthcare workforce. On Kemsa field rate, at the moment, I think it's about 47. For us to succeed, we must take the field rate in terms of drugs and equipment at Kemsa to 90%. And we are finding a way of how to partner with the financial institutions to support Kemsa so that drugs go to the last mile, last center is done. I think, Honorable Speaker, the last one was the member for Madeira, a very